Becoming a periodontist, a board certified periodontist, requires you to complete residency. However, just because you got in and that might have seemed easy, the hard part now is getting through the residency program. So, Doc, tell us what's been the hardest part about perio residency for you?
For me, the hardest part of periodontics residency was the first year. So I graduated dental school 5 years ago. So I threw away all my basic didactic books. I didn't want to see that at all after dental school. And so when I started periodontics, the first year is strictly didactics, biochemistry, microbiology, anatomy, all those core courses that I took 5 years ago that I forgot, I had to rememorize. So that was the most challenging part of the periodontics program for me.
After 5 years, wow.
Hmm. Yes.
Yeah. Okay. Gotcha. And it's a board certified periodontist where you are responsible for bridging the gap between oral health and overall health. Today, we're going to be talking to a doc who just finished her perio residency on her way to become board certified. And she's going to be sharing with us why perio, what a typical day is like as a perio resident, what research is required, things that she liked most, things that she didn't like as much, and also some of the challenges. And not only is she going to share tips and advice for those of you that are considering perio, but also she's going to lay out some of the best characteristics or most important characteristics that you need to have as a periodontist. So stay tuned, but also stay all the way through to this episode, okay? Just want to let you know that this episode is being brought to you by GetIntoDentalResidencyChallenge.com. This is the ultimate resource that helps you jumpstart your residency application so that you get attention immediately so that you can get into your ideal residency program of your dreams. For more detail, check out the link down below and use that resource for yourself, all right? So today we're joined with a person who's been on our episodes a couple times before, but it's been a while, right,
It's been
Doc?
some time, three
It's
years.
been some
Yes.
time because you've
Hmm.
been spending time being busy,
I was busy, very
busy,
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 trying to get through,
booked and busy,
booked and busy.
trying to survive and get through. Today we're
Yes.
joined with Dr. Shelly Taylor, who's going to talk all things perio, but more specifically how she survived the perio residency, which is 3 years. So, Doc, for those of you that haven't maybe watched our previous episode, which is, where is it at? It's right over here. Check out that previous episode over here. For those that haven't seen that episode, please introduce yourself. Tell us where you're from and where you just finished, what you're doing now, but also where you finished your perio training.
Cool. Yeah. So I'm Shelly Taylor. I'm from Fort Lauderdale, Florida, the Sunshine State. And I went to dental school at the University of Florida. So go Gators. I was a double graduate of the University of Florida. So I did my undergraduate there and also my dental school. And after graduation, I worked at a federally qualified health center for some time. And that's where I found like more interest in periodontics because a lot of my patients needed periodontal care but couldn't afford it. We had a periodontist who was able to help our patients, but I saw that was a greater need, and I wanted to be able to bridge that gap between periodontics and public health because we know that in our community really needs periodontal care. So I decided to get my master's in public health from Harvard University T.H. Chan School of Public Health, and that's where I learned more about how we could treat our patients better with education, research, bridging that gap between oral health and a person's overall health. And so when I completed my my public health program at Harvard, I continued on to Columbia, where I became a periodontics resident. And I was very excited about that opportunity because that is like my ultimate goal to bridge the gap between periodontics and public health in a federally qualified center setting.
What are the characteristics do you think are that make up the best candidates for perio? And associated with that, what are some of the things that candidates need to consider related to if you don't like A, then you don't need to be involved with perio. Perio's not going to be your specialty.
Got it.
So what are
Yeah.
some of those characteristics that make the best candidates for perio?
So, to me, I think the best candidates for perio is someone who's detail oriented, who has patience, and who can really educate the patient. And so I think the detail oriented is very important because a lot of our surgeries, we have to make sure we're very detailed, like, with implant placement, so we can have a good restorative outcome. With grafting, it's just very detailed, making sure we really clean out the site. It's fun, but you have to be detailed. You have to really look at it and make sure you're kind of like a perfectionist in a way. We have one faculty, I would shout him out, Dr. Escal, he's great. Before we do any surgery, we have to draw our incision line. And I love that because before you commit, let's draw it out and see how your final outcome would be. And so that's how detailed it could get in periodontics. And also like patience, because sometimes it takes a while for you to see the clinical outcome that you want in a patient. Like a lot of my patients now, I started with them from my first year all the way to the third. And then we could see like, okay, they're doing good with their oral hygiene, then they're doing good. They fall back. So it's just like having patience to be able to know that with further like education, more treatment, the patient can get there. And also just patience with the surgery. It doesn't have to be fast, quick. It's just you want to be right. You want to do good work. So sometimes being patient with yourself and not speeding through things, you can do very good work with that. And also, when I said like education, periodontal disease is not painful if you think about it. So like the patient is referred to you from the general dentist for bone loss, and you are telling them to do this extensive treatment to treat the bone loss in their mouth that does not hurt. And so, how can you convey that to the patient that they need this treatment to save their teeth? So, being able to communicate and educate the patient on their terms is very important in periodontics because we want to try to get the patient to that health outcome that we know we can get them to, but we have to make sure they understand it for themselves as well.
And this is where outside of dentistry, you have to be educated and aware of the psychology of individuals. This is where psychology matters, right? The other P in perio, psychology,
Yes.
right? Because like you said, it's a silent disease.
Mm-hmm.
That's a silent disease that destroys the dentition, right? But just because it don't hurt, don't mean it's not hurting your body in some shape
Exactly.
and form. So you almost have to not do Jedi mind tricks, and this is a reference from Star Wars for those of you that are old enough to go back to the original Star Wars where the Jedi, yeah, but anyway, where you change people's minds, but you change it based off of providing them information, education, and it has to be education, like you said, Doc. It has to be education that's on their level. Cannot be technical. Cannot be
Yeah.
clinical to the point where you're talking to them like you're talking to another colleague. They ain't gonna understand it, and they're gonna be so overwhelmed that they'll be like, "Doc Taylor, can you just take the tooth out?
And you don't want that. Yes.
Can you take the tooth out?" And they still may go that way, and that's
Mm-hmm.
fine. But then you got to have your Jedi skills ready to answer and tell them, well, if we take it out, then what are you going to do? Because you take it out, and now you got a hole in your mouth. And that hole in the mouth can lead to A, B, and C. You don't want that, do you, Miss Jones? No, I don't want no hole in my mouth. Exactly. Taking that tooth out is the last resort and there's no return. Like,
That's it.
right,
Yeah.
you may get another tooth in another lifetime, but I can't promise that another lifetime right now. We're
Mm-hmm.
working with right now. So it's almost like you have to really, you said, get that cooperation with the patient, but on their level and really tap into their psychology and of understanding about pros and cons and things that if they don't do something, what that means for them. And then again, you just let them make the decision, but you have to be able to educate that increases their awareness and their edge and their understanding of what can happen if you don't do A, B, and C, regardless if it hurts or
Exactly.
not. So, um, as a candidate for pedo, that's an important characteristic that you have to have, but also be willing to display and incorporate as part of you preventing the disease, but also treating the disease. And if you don't want if you don't want to have to explain those things, then like you said, perio may not be for you.
Exactly.
May not be for you. So, what else makes perio not for someone?
Yes. So if you don't like blood, I'm just going to be completely honest because it's going to be bloody
And that's
before
bloody
you
because
clean
of the
things up.
surgeries, right? Surgeries, right?
Yeah. So is when a person has enough disease that they're referred to you to treat, and it's going to be bloody. But once everything is controlled, then it will be less bloody. But if seeing a lot of blood is not your thing, I wouldn't go into perio.
Right. If you don't have the stomach for wanting to draw your incisions and then make those incisions and potentially have some bleeding and just that whole field of your work and surgery, if that's not for you, then if you can't stomach that, then maybe it's ortho, maybe
Yes,
it's oral path,
and that's fine.
right? Minus the biopsies, right, for oral path,
True.
right? So that makes sense. Anything else that would really kind of preclude someone to not go into perio? Who else is it not for as far as things that periodontists will do on a regular that if you can't be able to sustain this type of work environment, this is not for you. Anything else
I think
besides
that's
blood?
mainly it. I think that's mainly it
Okay.
because it's a surgical specialty.
Yeah.
So yeah, if seeing a lot of blood is not your thing, which is completely fine, I wouldn't go into periodontics.
Thanks for sharing those. Let's talk about the flip side, right? Because I'm sure there's some things that you didn't like, or maybe things that were challenging. So, what were some of the things that maybe you didn't potentially like as part of your training, and things that were challenging, and also how you were able to overcome them over the 3 year period?
Yeah, so the flexibility of the program also provided some challenges. So since it's basically you get whatever patient that is in your patient pool, if you need to do a certain procedure and that's not in your patient pool, it's kind of up to you to find that patient that you need to complete the requirement. So that was, and I think still is a challenge for like residents at Columbia because you're not really assigned cases. For instance, you don't really have a meeting midway and say, okay, I've done like so many implants, but I need to get a little bit more soft tissue. And then there's not a soft tissue patient pool that you can get your patients from. It's like really up to you to get those patients. So that was like a challenge, definitely for me and also some of my co-residents as well. And then also, since it's very like flexible, and I discussed like how I was out of dental school for some time, there wasn't a lot of focus on a lot of tests to test your didactic skills. It would be like, okay, we have a test at the end of the semester, and it's kind of like, oh my goodness, did I even like look at the material? So you have to really make sure you yourself stay up on the material because there's not really a lot of checkpoints until like, there's a big exam, and that's where the stress comes in.
That big exam for many people could be the first part of boards, right?
Exactly.
But I'm sure that the programs, and I'm saying this because most of the curriculum for programs will have time set aside and built in for preparing you for the written part of the boards, right? Well, also the clinical
Yes,
part, but first part is first, which is the
the
written part,
written.
because for many programs that is one of the ways that they can determine, or that they use to determine the success of their programs, right? What percentage of their residents are completing or become board eligible first, and then also go on to be board certified as well. So that's
Exactly.
a reflection of the curriculum.
Yes. So yeah, all my whole cohort, we all are board eligible. So we did it. So now we have the board certification. I think it's May of this year. And we just have to go through that, the oral boards, and then we're done.
Yeah. Great. You
Hmm.
said you have to go through it?
Yes.
Okay.
So yeah, board eligible now, and then the oral boards later in May.
Okay. And I'm sure, and again, like you said, it's another one of those things where you have to have enough internal accountability to make sure
Hmm.
that you're going over the material that you need, both on the didactic part, but also clinical as well.
Exactly.
Doc, what's the best way for people to contact you if they have some additional questions or just want to talk to you more about not only surviving perio as a resident in residency, but also future thoughts and aspirations as you are now living life after surviving perio?
Yeah, so they could email me. My email is shellytaylor.dmd@gmail.com, or contact me via Instagram at the_wisdom truth. And those are two ways people could contact me.
All right, there you have it. Check out those contact informations for Dr. Shelly. Doc, thanks so much for your time. It's been a process. It's been a
Yeah.
a long process from applying to Perio to also just finishing up that program up at Harvard, the MPH program for oral health, minority oral health focus, to now 3 years later finishing surviving Perio and fulfilling your dream via your dream position that was
Yeah.
more above and beyond what you dreamed about, but now how you are now living that reality each and every day. So congratulations, so proud of you, so happy for you.
Thank you.
And we thank you for your time. And I'm going to thank everyone in advance by going to this next episode. Go to the next episode right now. All right, go.